I am Bidinotto. I am in my last semester, the second year of the ADN nursing program at YSU. I've always worked in healthcare. I was a paramedic for over 20 years, and I worked in a couple other healthcare related fields. So working in nursing was always something I wanted to do. I chose YSU because it's close, it has a good reputation, it's accredited, and I've had a lot of other people that have gone here that have given me a really good recommendation to come here. I would say one of the biggest impacts for me in this program has been understanding that the staff has been on my side. I have been really lucky to network with them. They've helped me get a job as a student nurse extern at the hospital, which really gave me a chance to get a lot more exposure, a lot more experience. They've been a sounding board for me. They've really want us to succeed, and that's been really evident. So really, no matter what is going on in my life, I can talk to really any of them, and that's been extremely supportive and helpful for me. I chose the ADN program because for me as an older student, it kind of worked out better to do the associate's program first, and then continue on in a bridge program to get my bachelor's degree. There's a little more flexibility there for me to do that, and I can start working and earning sooner as well. It's a little bit difficult to choose my favorite class, but in the very first semester I had a clinical instructor who was an ICU nurse, and she was very good at breaking everything down and getting me to be able to look at lab work and test results and everything, to look at those things and get a good idea of what was going on with the patient. And she kind of lit a fire in me to want to get better at critical care, and that's actually what I want to do now. So, for the most part, I knew I wanted to go into critical care nursing. After having spent time as a medic, I wanted to go into more depth, expand my scope, and I just kind of became more entrenched in that thought that I wanted to do that. But it was good to get a chance to look at all the different kinds of nursing to really make that decision for me. During our mental health rotation, we had an opportunity to go to my community kitchen, to the homeless shelters, to intake facilities for drug and rehab programs and mental health facilities. There are so many more than I realized. It really put me in touch with the community to understand what kind of resources that we have to offer patients, so I know what to do to help guide people to the right resources when I'm a nurse. And it's been really enlightening as a person and as a member of the community, because I got to continue to volunteer with some of those organizations even after we did our rotations. I don't know that there's a way to be completely prepared. However, I think it might have been good to know that there was going to be a higher standard than other programs, because we're in medicine. We have to know it all. We really do have to learn as much as we can, because that's what we're going to actually be doing for a living, and we have to watch out for patient care and keep ourselves safe and everybody else safe. So an A in this program is not like an A in another class. You have to have a higher score, you have to do better, you have to know more, and you have to commit a lot more time to this, but it is definitely worth it. Maybe having that information ahead of time would have helped me schedule things out a little better at the beginning, but other than that, I think we were pretty well prepared by staff. Every clinical shift I have a little moment where I feel very glad that I chose this, and it kind of keeps me choosing it. And it can be feeling really good about, nailing a good assessment and coming up with the correct conclusion when I look at data, or it can be because I've maybe gotten close to a family or to a patient and gotten to see that I've made a good choice and made a difference and helped people. That's definitely been impactful for me.